Uh-oh. New research suggests that the healing process following breast cancer surgery may be triggering cancer in other areas of the body to spread. Studies of breast cancer patients indicate that they are prone to metastatic relapse 12 to 18 months after surgical growth removal. It's believed that dormant cancer cells in other sites previously kept in check by the immune system become active as the body focuses on healing its wound. Experiments on mice found that while T cells stall the growth of injected cancer cells, simulated surgeries in areas far from the cancer resulted in increased tumor growth and incidence. Mice given anti-inflammatory drugs during or after surgery developed significantly smaller tumors, which often disappeared completely. Early research in humans shows the same strong association between anti-inflammatory drug use and a decline in metastasis, but more studies are needed to confirm the data. How do you stop cancer?
Metastatic cancer could be stopped. A research team led by the Georgia Institute of Technology has developed a new treatment that can potentially stop cancer cells from migrating inside the human body. Cells contain cytoskeletons to give them their shape and to carry out functions such as division and movement. In order to move, the cytoskeletons produce protrusions called filopodia, which extends from fibers inside the cell known as lamellipodia. The protrusions help cells to shift locations. Lamellipodia and filopodia are overproduced in malignant cancer cells, enabling them to spread around the body at faster speeds. Cancer kills patients often through the spread of malignant cells, which is known as the metastases process. By attaching nanorods comprised of a small collection of gold atoms to the integrin of the cells, the cytoskeleton can be stopped from overproducing lamellipodia and filopodia, which slows down the migration of malignant cells. A low-energy laser of near-infrared light is then used on the cells. The light is absorbed by the gold nanorods, which then partially melts cancer cells and damages lamellipodia and filopodia. This can bring the migration of the cancer cells to a stop. If desired, the laser light can also be adjusted to kill the cancer cells. The experimental treatment shows no observable damage to healthy cells, which is an advantage over commonly used chemotherapy. In the experiments, scientists also did not see the treated cancer recur.
New vaccine kills cancer in mice. Stanford University researchers used immune stimulators to target cancerous tumors, and it worked surprisingly well. T cells that defend against cancer often end up overpowered by the disease, but scientists find they can be rejuvenated using CpG oligonucleotides and anti-OX40 antibodies. When a microgram of the immune-stimulating agents were injected directly into mouse tumors, the growths disappeared in about 10 days. CpG activates dendritic cells that help against tumor counterattacks, while anti-OX40 antibodies stimulate T cells into attacking the cancer. Once a tumor is destroyed, the cells move through the body to find and eliminate other similar growths. The experiment eradicated lymphoma in 87 out of 90 mice and also worked on breast, colon, and melanoma cancers. The team is looking to start clinical trials to see if the treatment will be as successful in humans. Penn provides rapid cancer diagnosis. Scientists at the University of Texas are wondering if the pen is mightier than the scalpel. The pen is designed for use during surgery. After a tissue sample is taken, the surgeon uses a pen connected to a mass spectrometer and foot pump to begin analysis. The pump sends water through the pen via the tubing and forms a droplet. This absorbs molecules from the tissue and is then sent back up the tubing for analysis. The machine investigates the molecules for signs of cancer and provides diagnosis in around 10 seconds. The device was showcased this week at the South by Southwest Festival in Austin, Texas. Robot algae wipes out cancer cells. Scientists at the Chinese University of Hong Kong have taken an algae more commonly used as a diet supplement and turned it into a cancer assassin. Researchers coated spirulina microalgae in iron nanoparticles before inserting it inside a rat's stomach. The iron coating, combined with spirulina's natural shape, allowed scientists to control it with magnets. Researchers also put the microalgae inside a lab dish where it eliminated 90% of cancerous cells after 2 days. Spirulina is reported to be toxic only to cancer cells. The biodegradability of the robot depends on how thick the iron nanoparticle coating is. The thicker it is, the longer the robot can operate inside a subject. Lead researcher Dr. So-Lee Zhang told the publication Science it's not ready for doctors to use, but reckons it might be in about 10 years.